Good morning, everyone, and welcome to the Pet Hospital of Granbury. I'm Dr. Scott McCall, and I appreciate you joining us for our second Facebook Live event. Today I wanted to talk to you a little bit about anesthesia and concerns and risks with anesthesia in your pet. As a practicing veterinarian, I have 19 years of experience, and one of the most common concerns that I hear from clients is, I know my pet needs this procedure done, but I'm very concerned about having them anesthetized. Either they've had a bad experience with a pet in the past, or they know someone who has, and certainly that's true of pretty much all of us, because there are risks involved with anesthesia. It would be wrong, basically unethical and illegal for me to tell you that don't worry, everything will be completely fine, or to guarantee success with a procedure. That's not something that we can do, because every individual will react differently to anesthesia. But what I can tell you is that it is of the utmost importance to us that we take every single precaution that we can to make sure when your pet's anesthetized that it's a safe and successful procedure. That's something that helps us sleep good at night, and just know that we're doing the best job that we possibly can. One of the biggest things that we've done, and a biggest change, and something I'm most proud of in the last few years, is that we have achieved accreditation by the American Animal Hospital Association. And part of that accreditation is that we follow the standards and guidelines that they have for anesthesia safety. And as a governing board, the American Animal Hospital Association prints guidelines such as these that talk to us and tell us current and the best practices to follow to make sure anesthesia is safe for your pet. This morning I'd like to go over some of those with you and just explain what that is exactly. So one of the first things that we do, and to me one of the most important and underutilized procedures in medicine today, is getting a good history and physical examination on a patient. We've all been to the doctor, and it's a quick process, and you're in and out, and they never take the time to really visit with you about concerns that you have or problems in the past. We try to be very thorough in what we do, and we want to know that if there have been particular problems with your pet with anesthesia in the past, we'd like to know what those are. And thankfully we have ways we can custom tailor an anesthetic protocol for them that will be different than something that they've experienced in the past if there were problems. The second thing is just a good exam. I mean, here's a stethoscope. It's the best piece of equipment that we carry when it comes to helping to know if your pet's healthy to undergo anesthesia. We need to listen to their heart and their lungs. We need to check their gums, make sure their gum color is good. And just a good nose to tail exam the morning of anesthesia will help us ensure that there's no problems that we shouldn't address before we undergo an anesthetic event. The next thing that we do in one of our AAHA standards is we do pre-anesthetic blood work on patients. The reason for this is because even with a good exam, you can't always tell what's going on internally. And as an example, this is a 6-month-old kitten that was very thankful and lucky to be adopted from our local animal control, and they brought her here for us to do a ovariohysterectomy, or a spay. So we did our pre-anesthetic blood work, and we found a couple of things that I didn't anticipate or expect. One is that she was mildly anemic, so her red blood cell count was a little low, and that could increase her risk while she's under anesthesia of getting good oxygenation to all of her cells in her body. The second thing we found is that her liver enzymes were elevated slightly. Now when you see that on a pet, it may or may not be a clinical concern. However, in a healthy pet like this, and because this was an elective procedure that didn't have to be done that day, what we decided was we would wait and reevaluate the patient a few weeks later, recheck this blood work, and make sure everything's okay. If she would continue to have problems, then there's other tests we can do to follow up or tailor our anesthesia so that it's safe for this particular patient. But we look for things like low blood sugar, anemia, as I mentioned, liver disease, or kidney problems. And those things can all affect how a patient reacts to different types of anesthetics. Another thing that we do is every patient under anesthesia gets an IV catheter beforehand, and we give them IV fluids, and we use an IV fluid pump such as this, very similar to what you would have in a human hospital. And the purpose of having an IV catheter and IV fluids is to allow good access and quick access to a vein in case we need to give medication quickly, to administer medications without the discomfort of injections in the skin or in the muscle. And then also IV fluids during anesthesia are one of the best ways to help keep a patient's blood pressure up so that they're not hypotensive, because low blood pressure is something that can cause problems while they're under anesthesia. The next thing we do is, we know patients can be nervous when they're here, and we know that surgical procedures can be uncomfortable or painful. So it's important for us to, once we've evaluated a patient, to give them some medication so that they're sedated and comfortable as quickly as possible. And that does two things. If they're under less stress, they're going to react more smoothly and evenly to anesthesia. And also, if we give them pain medication and a sedative ahead of time, just very low doses tailored specifically to their weight, then they don't need to have as much anesthesia, as much gas anesthesia while they're in surgery or having their procedure done. And by giving very small amounts, calculated doses of several different types of pain medications and sedatives, it allows for what we call balanced anesthesia. It's much safer for most individual patients. And as an example, I drew up two different doses of medication here, and I wanted to show you. These are special little tuberculin or TB syringes, and each one will hold 1 milliliter of a medication. This is a dose of a pre-anesthetic medication for about a 10-pound dog. And if you look here, it's calculated to the 100th of a milliliter. 0.04 milliliters is all that we would give this patient. And it's a very, very small amount in that syringe. I don't know if you can see that, but it's actually a yellow medication. You can see it in the syringe. In comparison, this is the amount that would be given to a 50 and over pound dog. So a tiny little bit for a 10-pound dog and a lot bigger dose for a bigger dog. That's important because we weigh every patient and we calculate to the 100th of a milliliter the dose of medication that they get, and we'll try to be as precise with that as possible. We also use medications that, should there be a problem, say their heart rate drops too slow, we can actually reverse that medication, give them a reversal agent, another type of medicine that will make the effects of that low heart rate go away. And those are all things, advances in medication that we have available today that weren't available in the past, and it really makes a big difference for these pets. So once we've got the pet pre-medicated, we have their IV catheter in, then we're ready to go into anesthesia. So we'll use another medication, induce their anesthesia, which means they'll be asleep. And then for almost every procedure, we'll intubate the patient. And this is an endotracheal tube, and this is an endotracheal tube. Again, this is the smallest one that we have, and it's for a very small patient, say a 5-pound kitten or a small puppy, or just little dogs like a small Yorkshire Terrier, something like that. This is a larger endotracheal tube, and this would be for, say, a 70-pound Labrador. And what this does, it goes into their airway. We inflate this cuff once it's inserted, and it seals off their airway so we can very accurately control their breathing as well as the amount of anesthetic gas that they get. If say a patient's under anesthesia for a dental procedure, by having their airway closed off and us only breathing through the tube, then the water that's used to clean their teeth can't get down into their lungs. It seals that airway off, and that helps prevent problems when they wake up, coughing or even aspiration under the procedure. So endotracheal tubes are used. We take the endotracheal tube and the pet's under anesthesia, and we hook them up to a gas anesthesia machine for most procedures. And with this hooks to the endotracheal tube, and the patient will be under oxygen, and we'll also give them gas anesthetic through that. And by having the preoperative medications and using good pain medication, as I mentioned before, we can use relatively low doses of gas anesthesia, just enough to keep them asleep, but so they're also comfortable. And that works really well for most patients. Another thing that we do is local anesthesia. And this is something that we somewhat borrowed from our large animal companions and practitioners, because even though a pet's under anesthesia, if you can block the nerves in the area where you're operating, for instance, let's say we're doing a dental extraction, and just like when you go to the dentist, they'll numb your mouth. even though a pet's under anesthesia, if we can do a dental nerve block while they're under anesthesia, then when the procedure's being done, they're less likely to feel that and wake up where we don't have to give them as much anesthetic. And that's extremely safe for them. It makes the procedure much, much safer. And then also whenever they wake up, they're comfortable, and we know that patients that are comfortable are going to heal more quickly. They're going to be less stressed, and they're going to go home wagging their tail just like they came in almost every instance. So local anesthetics are very important as well. Another thing that we do is while they're under anesthesia, just like if you were at the hospital having surgery, is we use surgical monitors, and there are several different things that we can measure while a patient's under anesthesia. We'll measure their pulse ox, or the oxygen saturation. We'll measure and monitor their EKG, electrocardiogram. We can measure their blood pressure, because as I mentioned before with the IV fluids, keeping their blood pressure up is very important to make sure all their organs stay healthy while they're under anesthesia. And so these surgical monitors are great. They're very durable, they're very accurate, and every time a patient's under anesthesia, we have them hooked up to a surgical monitor. However, we always have to remember that a monitor can trick you sometimes, so it's also very important we have somebody that's helping to monitor anesthesia. And that's where our good old stethoscope comes into play again. You can't always rely just on the monitor, so it's important to have somebody there who can feel the pulse, check the gum color, and make sure that the patient's breathing properly, that they're taking deep enough breaths so that, again, the procedure is safe for everyone. Post-surgery is very important as well, and one problem that we can have anytime you anesthetize a pet, or a person for that matter, as soon as you're under anesthesia, your body's ability to produce heat and to keep yourself warm is affected. So our surgery area it's a cool room, and when under anesthesia, patients tend to get cold. So we use appropriate heating devices such as this hot dog warmer or a warm water circulating blanket. These are products that have been approved for animals that are under anesthesia to help keep their body temperature up. Just as importantly is after the procedure. Once they're awake and extubated, we wouldn't just put them in the back where they're in the kennel area where they're not being attended and watched. We have somebody that will monitor those patients, and we make sure that their temperature is coming up and staying in the normal range, because if a patient's temperature drops after surgery, it can take them a very long time to wake up. And some of those bad stories you've heard about in the past where a patient just didn't wake up from anesthesia could very well be because their temperature dropped too low and they couldn't metabolize those medications. So the post-op recovery area, it's monitored, and we watch all those patients very closely until they're up and ready to go home. So we take anesthetizing your patient very seriously. I've had my own pets anesthetized, both before I was a veterinarian and even after, and I know the feeling. I know that there's concerns about it. It's important that if you've had a bad experience in the past, we'd ask that you'd share that with us. I mean, we're not afraid to have an open conversation about it. And if there's specific concerns that you have, then we'll try to tailor an anesthetic event specifically to your needs and the needs of your pet as much as we can, while we still are following those protocols by the American Animal Hospital Association. As always, if you ever have any questions, please let us know. I don't think we'll have time to answer live questions today, but we'll try to do that again in a broadcast in the future. And you can certainly get in touch with us on Facebook, and we'll try to answer questions as quickly as we can there. From the Pet Hospital of Granbury in Granbury, Texas, I'm Dr. Scott McCall. Have a great day.